Hey friends, this is Marlise Ledbetter, and this is your Live at 5. I wanted to talk to you guys about how CBD works, why it works, and why CBD maybe didn't work for you. And so I wanted to do a little video, not maybe a little, who knows how long I'll talk, but it is very, very important to me for you guys to understand how and why CBD works, and how not to use it and how to correctly use it. Because there's a lot of misconception, not just over what and how CBD works, but also how to use it. And I think that's the biggest issue I hear, is that either it's not working for people or they have the wrong expectations. So I wanted to get started with, first of all, if you want to know what CBD is, or you have questions around the difference between hemp and marijuana, this is not the video for you. We're going to actually talk about why CBD works in the human body. So if you want to know a little bit more about specifically what CBD is and the endocannabinoid system and things like that, you can jot over to my page or to my YouTube channel, which is Indie Hemp Co. Just Indie Hemp Co. INDIE HEMPCO. And there are a bunch of videos that will tell you all kinds of things about CBD. So first thing I wanted to talk to you about was how CBD works. So we have a system in our body. It is one of the largest systems in the body, and it is, dated back millions and millions and millions of years in human history, right? It is the endocannabinoid system. And it was originally discovered in the 1990s, early 1990s, when they were understanding how THC binds to our receptor systems. And so when they found out that our bodies actually, when they activate with cannabinoids, which is CBD, THC, CBG, CBN, CBC, all of these cannabinoids, activate or bind or actually, enhance the endocannabinoid system. And so when they found out we had this receptor system, which we're still learning about, we found out that it accesses the brain, the nervous system, the spleen, the liver, the endocrine system, so your hormone functions, your bone growth, your immune system, your gastrointestinal system, your muscle tissue, many of your organs. So this is a system that works in the balancing of our human body. That's really all its job. So to make it easier for you to understand what the endocannabinoid system is and how it works is simple. Think about it if you are trying to clean out a super dirty house, right? You can't clean the house if all the lights are off. Let's say it's in the middle of the night and you need to turn on all the light switches. The endocannabinoid system is what turns all the lights on. So let's say that you have a lot of chronic issues, you have diseases or disorders. There's going to be a lot more clutter in front of the light switches of every lamp and light switch on the wall that is going to be harder to get to, right? So the endocannabinoid system is the trigger. So when you take CBD in your body, the endocannabinoid system starts turning on these light switches. And once all of the lights are on, then it's easier for you to see where the dirt is, right? To clean things out, to organize. But when the body is in chaos mode or is in fight or flight and is not in what we call homeostasis, that perfect balance where everything is working how it should, then that means that your light switches aren't turned on. And all that CBD is meant to do is turn them on, because CBD is not healing you. Your body is healing you. And that's what people don't realize, is that CBD is not a sedative. CBD isn't a pain reliever. CBD is not all the things that you think it is. CBD is an activator, and it activates the functions of the endocannabinoid system so that when you're trying to clean up and get all the dirt out and figure out and organize your body so that all of the communications to heal you start happening, and the light switches turn on, that's what CBD does. That's what cannabinoids do. And it's really, really important for you to understand that legal cannabis, so below 0.3% THC, is not going to make you feel high. It will not. And really, THC can give you pain relief. It can block pain receptors. But if you take too much, right, you can have more issues of paranoia and worry and stress, and actually can make your pain worse, right? So why does that happen? Why is it that if you take too much CBD, the opposite happens? Because again, The purpose of CBD is to only start turning your light switches on, because you've got to let your body heal itself. Your body is more powerful than you think, honestly. I mean, we are able to do amazing and extraordinary things with our bodies. And if you look at people like monks who are able to meditate and self-levitate and do all of these things with our bodies, like they have focused and harnessed energies that most people can't even dream of doing, but our bodies are healing itself. And so when there's a lot of issues going on, it can take a lot longer for your body to heal, but that doesn't mean you take more CBD. So let's back up. So now that you understand kind of how the endocannabinoid system works, I'm just looking at some people tagging. Okay, cool. So when you take CBD, it's really, really important for you to find your sweet spot. A sweet spot is just the amount that your body needs to be activated. And we're not going to get into the other cannabinoids like CBDA and THCV. There are purposes for those cannabinoids. We're just talking about CBD today and some of the other minor molecules. When you take CBD, you have to find your sweet spot, and everyone's sweet spot is different. It's not based on age. It's not based on sex. It's not based on weight. It is like really 5 different factors: genetics, your overall health, the noise and sensitivity of your endocannabinoid system, age, sex, and height and weight have a little bit to do with it, and then also your metabolism. So how you process things. Some people may shoot through pain medicine like it's nothing. They can't even, go under with a regular dose of anesthesia. Like they have different genetics and different chemistry and different metabolism. Everybody's so different, right? So that means that there is not a one size fits all for CBD. There's just not. It's impossible for me to say to you, you can't sleep, you should take this dose. Oh, you have back issues, you should take this dose. Oh, you have this genetic disorder or this disease, take this dose. Because it is not, I have no idea how to look inside of your body and tell you how to do things. What I can do is guide you. I can give you ideas and suggestions to start with and what to look for and how to guide yourself and how to journal and things like that. So a lot of people come to me and they say, Marlise, I bought a bottle of Green Compass CBD. It said to take 1 dropper full on the bottle. That is a guideline because the USDA thinks of it as a food supplement. And a food supplement you eat or drink, right? Because we cannot tell people to put it under your tongue because then it becomes a medicine, right? So on the guidelines of the bottle, we are basically telling you to drink 1 dropper full, because when you take it internally, like an edible or a candy or any food item that goes, doesn't stay in your mouth or your oral mucosal veins, right? It doesn't go under the tongue. You just swallow it. Number 1, it gets partially burned up in your stomach acid. Number 2, it has to pass through the gastrointestinal system, and then it has to go through your liver processing. So by the time it gets to the liver, a lot of CBD has already lost its value. And then the liver processing changes the chemistry as well. So when you hold it under your tongue, you're absorbing a higher amount of CBD. But we can't put that on the bottle. We just can't do that. So you choose how you want to use the CBD, but the 1 dropper full is only a guideline, and it is honestly not good for most people because that's something you work up to eventually. And could it possibly be your dose, your activation point? Possibly, but 1 out of 100 people that I work with has that high of a dose. Most people are anywhere from a 1/4 of a dropper to a 1/2 a dropper. That's very typical. But let's talk about how you find your sweet spot. So those of you that know me from Green Compass and you hear me talk about this all the time, it's called microdosing. And microdosing is the only true way that you can figure out your sweet spot. So let's figure out how to do that. When you start CBD, the first thing that you should do is you should write down how you feel. All of the different things that you are struggling with so that you can start documenting what is happening in your body. Like how we feel, right? On a scale of 1 to 10, people are like, what is your pain level on a scale of 1 to 10? What's your anxiety level on a scale of 1 to 10? Those are not questions you should be asking yourself. It is a lot deeper than that. And there's a lot more things going on in your body that we don't give credit for. So it's really important to journal it. So when you first start taking CBD, kind of give yourself a scale of 1 to 10, 1 to 5, those things. And those can be found on my website, www.indiehempco.com. and it's on the Canna blog, and it's called How to Do a Reset and Why. So going back to microdosing, the best way to start microdosing is to just take 1 to 2 drops, place them under your tongue, and hold them there for 2 minutes. And as you're holding it, you're going to ask yourself those questions, or before you put it in your mouth, you're going to ask yourself those questions. And then you're going to wait 30 minutes. It takes less than that for your body to pass it through the bloodstream. It starts, either activating or not activating yet. And you can continue that process throughout the day, but most people don't have time for that, right? I don't have time to wait 30 minutes and then take 2 drops again, and then wait 30 minutes and take 2 drops again and wait 30 minutes, right? If you were in a clinical setting, it would be a little different situation, but I'm going to guide you on the best way to do it for a normal dosing day when you don't have a lot of time to do all the things. So you take 2 drops under the tongue, 1 to 2 drops under the tongue, hold it for 2 minutes, and do that twice a day. Most people that struggle with rampant thoughts and maybe they struggle with sleep actually do better by taking it in the morning and the afternoon. I've found, and this is not like a study, I'm just saying I've treated like over 1,000 people and I've worked with them, and I've found that you don't have to take it right before you go to bed for sleep. Now, some people feel more sedated and relaxed when they take CBD. It is just their chemistry. But for me, I tend to get not necessarily wound up, but I feel a burst of energy when I take CBD. It makes me focused. It helps me stay calm. My worried thoughts go from here to here. The discomfort in my body kind of melts away, and I feel really good, right? But if I take it in the evening, I tend to be too focused, and then I want to start writing stuff down and figuring things out. And I mean, I am a mile a minute kind of thinker. So for me, morning and afternoon, no later than 5 p.m. or even 4 p.m. is what works for me. You document what works for you. So if morning and afternoon make you too relaxed, then do afternoon and evening, or just do all of your dosing in the evening. And that is the way for you to figure out what works best for you. So number 2, so that's what you do. 1 to 2 drops under the tongue twice a day. Then you're going to keep that dose for 3 days. The reason that I chose 3 days, let's do this way because I can't bend my finger that way. 3 days, you would want to do that because, or this way for the Europeans, your body needs, number 1, to assimilate what is happening in the body, right? We need a few days for the body to get used to what's going on. If you immediately double your dose or increase your dose or take more doses, that's not fair to your body. Your body needs a little bit of time to figure it out. Number 2, CBD and THC and all of these things do build up in your system. So they accumulate. So you have to take in consideration assimilation and accumulation. So when your body continues to accumulate, you don't want to make, let's think about it as a mop, right? You're mopping up a spill, but you can't wring out the mop if more water is being poured onto it, right? We need a little time to wring out the mop and then mop up the spill again. So think of that as your endocannabinoid system. If you go too far, you're pouring spill on a spill you're trying to mop up, right? So it makes no sense for you to go, oh, I felt really good today, I'm going to double my dose. Do not do that. Don't tell your customers to do that. Don't do that yourself. If you are a guide of CBD, please, please, please use the 3-day rule. It really works well. It gives people time to get settled in that dose. And then after 3 days, then they can move to 3 drops. So you 2 drops twice a day. So it's 2, 2, 2, 2, 2, 2. Then we move to 3, 3, 3, 3, 3, 3, and 4, 4, 4, 4, 4, 4. If you're taking a higher concentration, it's really good to do it by 1 drop. If you're taking the 500 milligram or the 750, you can do maybe 2 drops, but you don't want to just double your dose out of nowhere. Most people do really well with an average of 10 drops, but if they're highly sensitive, then that might be too much for them. And how many times have you heard of someone taking CBD and they're like, it gave me a headache, I felt nauseous, I had loose stool, I felt jittery, or I felt too relaxed, right? These are all sensitivity issues, and they can also be a trigger of detoxing. CBD, if your endocannabinoid system needs to release some toxins, there's some buildup in the system, part of the balancing act is also cleansing, right? You can't go and work out in a dirty pool with leaves everywhere. It's got to be cleaned out first. So we have to allow our bodies to work through a cleansing or a detox process if it has to happen. But you don't want to immediately push someone to a detox because it's uncomfortable for them, and then they won't want to keep using CBD. A lot of people will take it and they're like, it kept me up all night. Let's say they're using it for sleep. I was up all night. I was worried. I felt dehydrated. I had a headache. I had loose stool. They probably just overloaded their system with CBD and now they're detoxing, and nobody wants to feel that. So we'd like the body to detox without any of the symptoms of detox, if you know what I mean. We want the balancing act to be easy and calm for the body, for the user. Number two is, as you're doing these increases, you have to look for the following. You're going to look for any change at all. Right? Isn't that scary? You're like, you want to say to the person, okay, stop doing an increase when you feel no pain. I mean, first of all, if they've been living with chronic issues or they've been living with a disorder or disease that cannot be cured, we cannot tell them that. We cannot tell people you're going to feel cured in amount of days. There's no possible way for any of us to know that at all. Not even the clinicians that I work with, that I have been trained by, and I do these webinars every other week. They are doctors that have been doing this for like 15 years, and they still don't know what works for everybody. And so it's really, really important for you to say it could be 3 to 6 weeks. It could be 90 days, depending on your level of genetic makeup, your overall health, what kind of diseases and disorders are going on, because that all affects how the endocannabinoid system is able to start, clearing the house, turning all the lights on. So let's say somebody takes 4 drops, right? And they contact you, or I'm talking to you as a user. You take 4 drops and you're like, I had a great sleep last night, Marlies. I felt so good. I woke up energized. Okay, don't increase anymore. There's no purpose for you to increase at this point. Now, we might increase in the future, but for right now, that means, boom, your endocannabinoid system is turning on, right? And over time, it's going to continue to start turning on those light switches. But you don't want to just go, oh, I feel great at 4 drops. Now I'm going to take 8. Because guess what? If you take 8, that might be your saturation point. And then your CBD doesn't work anymore. So cannabis and lots of other things that you can take are what's called biphasic. So you take too little, doesn't work. You take too much, and it can actually do the opposite. Have you ever heard of someone using cannabis and saying, I had more anxiety, I had more pain, I couldn't sleep, I was paranoid, right? All those things. CBD won't necessarily make you feel that, but it can enhance somebody's feeling of worry or discomfort. So you always want to make sure that you're sitting in this beautiful bell curve that everybody has. It's called the therapeutic range. You've got your minimum amount that needs to work, and you've got your maximum amount. We're trying to find that sweet spot where your body is functioning as it should. And it can take a really long time for those of you that are just not well. And you have to remember that healing takes time. This is not a magic pill. And really, there are no pills that are going to boom fix you. Your body has to heal itself. And so I want you guys to realize that your sweet spot is going to be different, but you're looking for the activation point. So number one, we know how the endocannabinoid system works, right? It's a communicator. It activates your body. It creates its own chemicals like anandamide, which is called the bliss molecule. If you ever take CBD and you feel like you just had sex, that wonderful, relaxing feeling, or you've had what we call runner's high, where you feel euphoric and uplifted, that's anandamide. Your body's creating that. It's not CBD. It is not THC. It's none of those molecules. Your body is creating that chemical response, that molecule. And so anandamide is what makes you feel that. So if you don't like that feeling, then we can just change around your dose. But that's a natural, like a normal chemical response. Also, 2-AG is another response of the endocannabinoid system. So these are not really molecules or compounds. They are actually endocannabinoids. So our body makes endogenous cannabinoids, so the ones that exist in our body. And then cannabis is a phytocannabinoid. It comes from plants. So the cannabinoid from the plant interacts with our endogenous cannabinoid system, and then our endogenous cannabinoid system makes our own cannabinoids. Does that make sense? So you eat something or you take something that activates your body, and then your activation creates something else, right? Because CBD doesn't heal you. CBD is not what is going to make you fall asleep or take away your discomfort or make you less stressed. Your body is doing that. Does that make sense? So it's people do not understand CBD. They just don't. And it really, really makes such a difference that when someone comes to me and says, Marlise, I was taking 20 milligrams of CBD and I've been taking it for the 3 weeks and I feel nothing. And it makes me think, maybe we should go back and do a reset. So if somebody is saturated, what we call a saturation point, they need to do a reset. They need to abstain from taking products for three days, let the body kind of deactivate, and then start in microdoses again. And I'm telling you what, I've had people with some of the worst issues say 5 drops of the 1,000 was perfect for me. But they thought that they needed to take 3 dropperfuls a day. But it's not like Advil. It's not like a prescription medication. You can take 2 Advil and then you take 4 Advil and you have a better pain relief, right? But that's not how cannabis works, because it's not a pain reliever. The function is for you to enhance your endocannabinoid system and let the body do the rest. So if you think about it, you have to be patient and you have to be willing to experiment. And I know that there are those of you out there that are desperate, that you want relief right now. And there are lots of things that you can do. If you have a lot of discomfort on your body, use a topical. A topical can give you what we call acute relief. You have acute pain, or you have a discomfort on your body that is giving you issues, then you can use a topical. Topicals will go right to the issue of the problem. And most people will get relief from a topical right away. Another thing is use calming essential oils mixed in with CBD, creates a relaxing effect or a stimulating effect or a joyous effect, there's all types of different essential oils. If you haven't seen our roller balls right here, these roller balls they're formulated for a reason. And the different essential oils are able to do certain things with our body. And then the CBD kicks it up a notch. If you haven't tried bath bombs, soaking in CBD is not only relaxing and forces your body to settle down, but it really is great for acute issues. CBD internally is what is activating the endocannabinoid system and triggering, you cannot take topicals and it access your brain. Okay. Internally is the only way that you can access the CB1 receptor system. And CB1 is your brain, your nervous system, and a bunch of other things. So if somebody is looking for something to help them with a brain-related or mood-related issue, they need to take it internally. Any questions? I would love to answer your questions. Thank you, Jennifer. I really appreciate that. Kim, thank you again. I appreciate that. Tiffany, thank you. Glad you're getting some help from this. Okay. I'll wait a little bit for some questions. But hopefully that helps you understand. I'm going to show you a little graphic on the actual endocannabinoid system and how the receptors work. Okay, that's a really good question, Jennifer. I usually tell people to start with what your budget allows. With issue, it depends on the severity of issues sometimes, but it also depends on their overall, like all the things that I just told you. Overall health, genetics, metabolism, age, biological functions, how many things are going on, how many different types of symptoms. Is it brain related? Is it nervous system related? Is it gastro related? Is it muscle related? I mean, if they've got multiple things going on, it could possibly be that they need a stronger tincture. But I always say start with budget. If you could afford a 1,000 milligram, then go with the 1,000 milligram and start microdosing with 1 drop, because the higher the concentration, the more money you save. Did you guys know that there's like money saving every time you go up a tincture? Like, so 500 isn't the same price as a 1000 doubled or a 500 doubled, right? Because it goes 85, 110, 140. So I always say start with budget and start with what the person expects to get out of it. And sometimes you have to say that, you know, this could take 3 to 6 weeks. I usually say 3 to 6 weeks as a general rule. With things that are more behavior based, it could be 90 days. Because remember, we do have to, when you're taking something and you're balancing and you're producing new chemicals and the body is trying to get itself to homeostasis, if it is behavior related, typically that person needs to relearn how to react to certain stimuli or stress related activities, or how to create a better, more sleepful or restful sleep. So it totally depends on what's going on with the person. But I always say budget is most important. So if they can only afford a 500, they might have more increases. It might take a little bit longer time to find their sweet spot because the dosing is a much lower in the concentration of cannabinoids. But typically you want to microdose with everything. Okay, did that answer your question? Feel free to ask me another question. If anybody wants to know what I just answered, this is the question. So we have some questions here, so I'm going to throw them up. Okay, Donna asks, would it make someone dizzy? And you can't see the rest of her comment. Donna, not necessarily normally. CBD should not make you dizzy. It shouldn't make you tired. It shouldn't make you feel anything that prescription drugs could make you feel. If someone takes too much and they're going through a detox, it is most likely that they are slightly dehydrated, and they need to drink water, and they need to back off their dose. So yes, it can happen, but that is typically an indicator of too much and a detox response. So hopefully that helps you, but no, not normally. It doesn't make you dizzy at all. Okay, Jennifer asks, do you recommend the full spectrum more over the isolate? Yes, I always recommend full spectrum. The only time that I recommend isolate is if they're drug tested. That's the only reason, because full spectrum is safe for everyone at all ages. The only time that I would recommend an isolate is for pets, because they do have a much more sensitive endocannabinoid system. Every animal species that has a spine has an endocannabinoid system. So mammals, reptiles, fish, birds all have endocannabinoids. Their body produces endocannabinoids and they have an endocannabinoid system, but they have very different systems than us. Humans are much more complex and they require much different things. And so we like to give them an isolate because their levels of sensitivity to THC are much different than humans. Even though it cannot make us high, our full spectrum will not make you high ever. But it could trigger a response with a pet. So always we put isolate in our pet tinctures for anything other than a human. And humans can use the pet tincture as well. So if you have a sensitivity to MCT oil, you can use the pet tincture that has hemp seed oil, and you should be fine. So okay. Let's answer this. Can you get a high from the 1000 milligram full spectrum? Again, Donna, you cannot get high. The levels of THC in all of our products will always be under 0.3% dry weight. And it is really impossible for you to ever get high at that level. Unless you are hyper sensitive. I've only seen it in 1, maybe 2 people ever that I've ever worked with. And we're talking thousands of people that have been highly sensitive, but we backed down on their dose. And it turned out that they just needed 1 to 2 drops of the 500 milligram full spectrum. So it doesn't mean that there's more THC the higher you go. Actually, the 1000, so here's the thing. The numbers on the bottle are indicative of how much CBD is in the bottle, not THC. So 1000 means there's 1000 milligrams in that bottle. 750 means there's 750 milligrams of CBD in that bottle. The 500 means there's 500 milligrams of CBD in that bottle. But also you have to realize that the higher you go, the more CBD you have, the less THC you could have. So, and that's just how the plant works naturally, because CBD and THC don't really exist together at exact balanced ratios, because CBD is an antagonist of THC. So the more CBD there is, the less THC that you'll feel. Does that make sense? And we even have a 2,500 milligram, and no, you can't get high from that either. Okay, we have another question. Jennifer asks, so essentially if a person gets a headache from taking CBD, it's because they're either taking too much or the body is detoxing. Yes, yes, 100% yes. Because CBD will not give you a headache normally. That's not, there are really no negative side effects to CBD at all. There are discomforts that can happen through taking too much or too little, not finding your sweet spot correctly. That's why I tell people, do not take a full drop, or don't even take a quarter of a drop, or sometimes do microdosing, because it is better to ease it into your body than overload your body. And taking more is not going to make you feel better. Like I said before, taking 2 Advil and then taking 4 Advil is going to give you more relief, but that is not how CBD works. You can easily overtip your endocannabinoid system. You can get saturated and it'll actually do the opposite. So if someone's taking, let's say a 1,000 full spectrum for sleep issues, and they take a full dropper full, that could actually keep them up all night. So you always want to find what your sweet spot is, because it's all about balance. And you guys have to realize balance is key. Cannabis is not a magical pill. It is all about balancing your body to heal itself. And I know that sounds like crazy talk, but yes, our body is actually capable of healing itself. And so if we can give the communication ability for our body to find the issues and help deal with them, then that is why it works for like 1,000 different things. And then detoxing, yes, it's very different for everybody. If someone has a very poor diet and they have a lot of health issues, they're going to have a higher risk of detoxing. Detoxing is typically an indicator that there's a lot of inflammation. And even somebody who seems healthy can have a lot of inflammation, whether it's in their brain or their tissues, or they have a lot of toxins that are built up in their fat cells. You have to remember that when the body does start balancing, it also cleans itself out. So if someone has a high inflammatory diet, they eat a lot of dairy, then they might have a detox issue. If they don't drink enough water, or they consume a lot of sugar, CBD does not like sugar. So if you're having a high sugar diet, you can probably count on CBD making you either not want to eat it, or lessen your consumption of it, which is really, really important for us to be able to do that. Rita asks, what do you mean by detoxing? So people that are healthy will still have environmental toxins in their body. So it can be anything from the things that you touch, to the air that you breathe, to any chemicals that may have been built up in your body. It could be literally anything. And also, if they have a poor diet, they're going to have a higher risk, not risk, there's really no risk, but you do need to detox. Like, detoxing is good, but it's not comfortable. So I always tell people, allow your body to detox on a level that you can't feel it. So if you feel like you're detoxing, back off your dose, and then continue to slowly increase it into your body every 3 days. Do an increase of 1 or 2 drops. But detoxing is very, very important because you do want to release the toxins out of your body. And then another thing to keep in mind is that if someone has a lot of inflammation, they're also going to probably go through a detox. So that's another reason why you want to microdose, because the more issues of inflammation there are in the body, the slower you want to ease it into the system. Okay, we have another question. I have a client that has a medical marijuana card and likes to smoke the cannabis. Can she also take CBD oil drops? Yes, yes, 100 times yes. So I am certified in medical cannabis, and so I studied actually longer marijuana than I have hemp. And I know the history of hemp like the back of my hand, but I know a lot more about medical cannabis than I do about CBD, and that might seem shocking to you. So I do guide a lot of people with medical marijuana, or they're going into a dispensary for the first time, that's what my business, Indie Hemp Company, does. So we have practitioners all over the country, and we have people in dispensaries and medical facilities that help guide people that I refer or they refer me. And so, yes, when you smoke medical cannabis, typically there's not a huge amount of CBD, or it depends on the ratios. So a lot of times you'll hear the terms like 1-to-1 or 3-to-1 or 5-to-1 or 18-to-1, or there's these ratios, and that means the amount of CBD and THC. And so those are the ratios that you find. I typically like, when someone does have a medical card, to take CBD one time a day and then use their medical marijuana another time of day. Because CBD, the molecule CBD, is really what is doing a lot of work. And THC is important. THC does do a lot of very specific things, and in the higher levels in legal states, it is beautiful for certain types of very specific functions. And that's why we shouldn't be afraid of THC, because THC does have its place. It is very, very much so, has its place. And then there's also acids, THCA, CBDA, and homologs or varins, which have the V at the end, CBDV, THCV, and these all have purposes. The acids have a very powerful ability to help with tumor growth and cutting off the blood supply to tumors and things like that. And there is research on this, and it's very important, but that is not our CBD. CBD that Green Compass sells is not specifically for that. And so medical marijuana is very much so something that you can explore if you're in a legal state, and taking both of them at the same time, different times of day, can get you the results that you're looking for. But again, I can't diagnose you. I can't give you the exact dose. I can't give you what's going to work and what's not going to work. It's so much experimentation, which is fun and exciting, and sometimes also frustrating because people don't have patience. Again, like I say, cannabis is a patience plant. So you have to allow your body to find out what works for you. But yes, I would absolutely suggest her to take both. It's very helpful. Does CBD work the same if you drink alcohol? They do not interact with each other, especially if you're taking it under the tongue, you're bypassing the liver. I don't recommend drinking a lot of alcohol ever, but if you do, it's not going to interact like pain medicine or anything like that. So no, there's not. It's safe. Also talk to your doctor. All of the advice that I'm giving you guys are from years and years of research and studying and certifications and working with doctors that specialize in cannabis. This should not be taken as a rule of thumb. As always, when you're starting any supplementation, you should always talk to your doctor. You should always make sure you talk to your pharmacist before any start of an additional supplementation, because of possible interactions or side effects and things like that, that not necessarily occur with CBD, but can occur with the medication and can be enhanced or stifled by the CBD. So make sure that you're always doing that ahead of time. And do not act like a guide for your customers. And for those of you that take CBD, that work with me directly, you know that we always talk about that. We always talk about, have you talked to your doctor first? Have you talked to your pharmacist? Or we will have, if you don't have a doctor or a pharmacist, we have somebody that you can consult with that is a medical professional that's licensed and specialized. But that is for my business, because I am the owner of Indie Hemp Company. I'm not a doctor or a nurse myself. I'm just a practitioner. I really am just an educator, and the rest of my team that are medical doctors and therapists and nurses and things like that, they are the ones that can give the real true guidance, but only after consulting with the client directly. You can also interact with me on my website, which is, again, www.indiehempco.com. And you can message me right through the website. And you can also visit me on Facebook at facebook.com/indiehempco. So those are all the ways to interact and ask questions. As always, I am a presidential founder with Green Compass, but this is not a Green Compass training. This is separate, and this is guidance through Indie Hemp Company, through my personal business, just to give you some typical guidelines on how to use CBD, why it works, how it works, and probably now you'll know why it didn't work for you because you probably took too much. And that's, I hear it every day. Every day someone comes in and tells me, I've been taking like 5,000 milligrams a bottle 3 times a day. It's like, no, you don't need that much. But best rule of thumb, experiment, be patient, be healthy, and be kind to yourself. And that's it for me. So I will leave you be, and I hope you guys have a great day. Thanks so much for watching.